The state mandates that school-age children get vaccinated against many diseases: chickenpox, measles, mumps, diphtheria, tetanus, hep B, whooping cough, and polio. And during the pandemic, public health officials are worried about some of those serious illnesses passing through the halls as routine immunization rates are dipping.
As Madeline O'Neill tells us, doctors say that makes outbreaks of preventable diseases a real concern.
Right. Well, those vaccines are required at certain ages because those diseases can be serious and prevented. When immunization numbers dip, that can lead to a rise in cases, especially with kids heading back to school.
So how realistic is it that we could have an outbreak of one of these diseases we vaccinate against?
Yeah, it's really, quite imposing. That the likelihood is actually quite high.
As eligible children step up for the COVID-19 vaccine, many others have fallen behind on other shots.
During the pandemic, we had a lot of patients choose not to come to the doctor's office.
In 2020, Wisconsin Department of Health Services data shows routinely administered vaccinations, shots to prevent against things like mumps and polio, dipped below the 2015 to 2019 average across the board, and especially for 5 to 6-year-olds.
It's really that school age group that we're most concerned about at this point.
Dr. James Conway, a vaccine expert and pediatrician at UW Health, says with herd immunity threatened in certain pockets and increased travel, disease is ready to strike.
And so they're out there, they're waiting to hit, and certainly this is a perfect setting where it may happen.
Possible outbreaks, which have happened over the years across the country, are on the radar of our state's Department of Public Instruction, too.
Disease can sneak up on you, particularly like measles, which is so contagious and easy to spread.
DHS numbers show that the percentage of students with a waiver getting them out of required vaccines for medical, religious, or personal reasons has increased steadily over the past 2 decades, from 1.6% in 1996 to 5% this past school year.
We've been nervous about that for a couple of years.
I don't want parents thinking, oh, it's no big deal, because all of this stuff is, or we wouldn't have the vaccines.
SSM Health's Dr. Dan Beardmore knows that firsthand with chickenpox, which can spread and be much more deadly in adults.
My sister and I got it when we were little, and my sister was sick, and I was too, but it wasn't that bad. My mom was nearly in the ICU. I've actually tested a number of kids this year for chickenpox, worried that it might be because they were unvaccinated children who had missed their appointments.
Doctor's message is that offices are open and safe to get kids back up to speed.
It's very likely that many of their kids have fallen behind, and I think vaccines are going to be more important than ever as we move forward.
Doctors recommend making an appointment quickly, even if just for those routine vaccinations, because they're filling up fast ahead of school. And we know many schools will be requiring masks, so that could, of course, stop the spread of a lot of these preventable diseases as well.